Everyone, so we're going to get started with health insurance subsidies and cancer insurance. And we have our health insurance expert here, Mark Rodriguez.
Good afternoon, everybody. Thank you, Harold. I am going to go over health insurance subsidies and cancer insurance. I have Elizabeth on standby answering any questions. If you have any questions, please add them to the chat and she'll happily answer them for you. So first of all, options for our retirees regarding health insurance is once a member retires, they are eligible to sign up for our insurance with United Healthcare, Cigna, and Delta. If they were employed under an ADOA employer, they do have the option of electing insurance under them. They can also have the insurance under COBRA through their retired employers, the private marketplace, or if they are returned to work with a participating employer, we can go ahead and apply subsidy to them if they request it. Health insurance subsidy. In order for a member to be eligible for health insurance subsidy, we'll go ahead and apply it a monthly subsidy to their insurance for any out-of-pocket portions under public safety. Subsidy is based upon the insurance coverage type, medical for family and or single, and it is also dependent on the retiree's Medicare status. For EORT members, their subsidy is determined based on their years of service. After 5 years, it is adjustable up to 8 years. At 8 years of credited service, they are eligible for the full subsidy amount. Health insurance subsidy can be used for the member's out-of-pocket portion for their medical and dental coverage. Both are considered eligible for insurance by our system for the purposes of receiving subsidy. This screen here will let you know the member subsidy amount. For non-Medicare members, it starts at $150. Once a member becomes Medicare eligible, the subsidy does drop down to $100 for single. If a member is not Medicare eligible and they have a covered dependent that is also not Medicare eligible, the member is eligible for $260. If a member has one dependent that is on Medicare and another that is not, they are eligible for up to $215 of their out-of-pocket amount. For elective officials, at 5 years of service, their subsidy starts at $90 up to $129 up to $156, depending on if they are Medicare eligible or if a dependent is Medicare eligible. After 8 years of service, they are eligible for the full amount of subsidy. Again, that is between $100 if they're Medicare, up to $260 for non-Medicare with a dependent. Applying for subsidy. If a member is applying for subsidy, the member must fill out the public safety enrollment form. We will apply subsidy to our insurance that is administered through Arizona State Retirement Systems. Also, if a member does elect to take insurance under ADOA, the member needs to contact ADOA. ADOA contacts us, and we'll go ahead and send subsidy over to ADOA for their out-of-pocket portion. If a member is requesting subsidy to go to their current return to work employer or their retiree employer, that employer must submit an employer subsidy retiree form to us. sub forms must be completed by the employer and emailed back to the insurance department to be eligible for that subsidy. Subsidy can only go retro back to the current calendar year. For employers to be administering the health insurance, the retiree is taking the employer's COBRA or the retiree insurance. The retiree can request subsidy if they are returned to work with a public safety employer, or if the retiree is taking a private health insurance, not a group health plan, the employee or retiree can request the subsidy be sent to that employer if the employer chooses to administer it. Right here, you're seeing our employer subsidy request form. This form is to be completed by the employer at the time of the member's retiring, or if the member is a return to work. This form here, what is really things to remember is on this form, we need the effective date, the first date of the month that the policy is effective, or if this form is sent in to end the subsidy, we need the last day of the month that the policy is terminated. We also need to know if this is going to be a premium deduct or subsidy only. For retirees, for return to work, it is always just subsidy amount. If the member is a return to work, we need the hire date, the position, along with a copy of the local board approved minutes. In section 2 of this form, we need to know if this is an add, if they're adding coverage, they're terming coverage, or if there's no changes. That's especially important during open enrollment. We also need to know the member's monthly out-of-pocket cost. And again, in order for the member to receive the subsidy is just for the member's out-of-pocket cost. If they are returned to work, that does not include any portion that the employer is paying. These forms need to be received by the 10th of the month in order to be processed the same month that they're received. We'll only issue subsidy for a calendar year. Also, employers, please remember to notify us if there's any rate changes. I know rate changes go into effect fiscal year and also calendar year. Please notify us prior to that so we can make sure we have our tables updated and there's no incorrect subsidies being sent out. Questions employers might have from members. I know at times I get a lot of questions from employers that members may be asking them. Can my spouse cover me on her insurance and receive my subsidy? The answer to that is no. The subsidy is only for the member's policy. The member may cover the spouse or dependents, then they can qualify for the subsidy. But if the spouse is the primary, it will not qualify for subsidy. Can my employer administer subsidy on my private policy after I retire? That is up to the employer. If the member decides to take a private policy and the employer chooses responsibility of verifying the coverage and the out-of-pocket premium, then we will go ahead and send subsidy over to the employer. We never send subsidy directly to the members. Can an employer receive subsidy for a member that is working for a non-PSPRS employee? According to statute, if the retiree became a member prior to 2013, actually September 13th, 2013, that retired employer can take responsibility. But again, that is a lot of responsibility and a lot of extra work for that employer to go ahead and verify coverage, verify the member's out of pocket, and to also keep an eye out when the member is employed and or terminates that with that employer. If you guys have any questions regarding the public safety insurance program, please feel free to visit our website. You can also reach our office and or submit any emails to the insurance group at psprs.com. Now on to the cancer insurance. Our cancer program has been around. We currently cover over 30,000 active and retired first responders and correction officers. The cancer program is available to help supplement benefits to the public safety members along with retirees. The plan is also for correction officers employed by participating employers. Not all of our correction employers have elected to participate with the cancer insurance program. It helps active and retired members offset expenses related to the cancer diagnosis and treatment. It provides a direct benefit payment and or reimbursement for out-of-pockets. The elective official program is not part of the cancer insurance benefits. Annually, we distribute approximately about $3 million to our retirees to assist with their cancer treatment. In the public safety cancer insurance program, their employer's responsibility. We ask employers to please keep our members aware of this benefit that's out there for them. Every once in a while, we'll get members that contact our office and let us know that they were not aware of this. So please remind your members if the HR department hears that a member has cancer or if a retiree has cancer, have them reach out to us to see if they are still eligible. Also for correction employees, new hires, they have 30 days to opt in. They can also opt in during open enrollment. They need to contact the HR department in order to opt in. For more information on how to set up a corp employee, please feel free to reach out to our cancer department. The cancer insurance program, the employers must have added the retirees into their payroll. When the payments are sent out to the retiree, when the members apply for their cancer benefits, 1/3 of their payment of their benefits will be sent out to the employers. The employers will need to run that through their payroll system and treat it as a income. And will need to be taxed. We will also provide a copy of a W-4 from the member and an A-4. So you guys know how much to take out for taxes. We'll also submit to the employers with that check the member's address. Lastly, remember the claim payment charges impact public safety members, not correction members. Also to let you guys know, this will be the last year that we will be sending out payments to the employers. This program ends in the end of 2024. Statute did change into a buy-down program. And like I said, 33.34% of these benefits go to the employer to be taxed. The other 66% does go to the member non-taxable. The benefits that are payable, you'll be able to see right here. We also started an indemnity payment as of the first of the year. When a member does submit a claim for the cancer diagnosis, a skin cancer, we will go ahead and process their benefits along with submitting a advance reimbursement payment to help the members with any out-of-pocket costs they may accrue. If you guys have any questions regarding these indemnity payments or the cancer benefits, again, please reach out to us at public safety cancerinsurance.com.